There we go. Okay, welcome everyone to this Maternity Consortium event focused on delivering inclusive specialist perinatal and maternal mental health services. I'm Celeste, I'm the Maternity Consortium Coordinator and Engagement Lead at the SANS and Tommy's Policy Unit, and it's really great to have you all here today. There are quite a few people across various different organisations and roles, so please do introduce yourselves in the chat if you haven't already, and do use the chat function throughout the event to talk to each other and make connections and all that good stuff. It's what these events are for. So I will just give a bit of background to the Maternity Consortium and the work we're doing for anyone who doesn't know, and then talk a bit about why we're running this event, and then we'll hear very briefly from NHS England, and then we will go into the amazing workshops that our facilitators have planned for you all today. So for those of you who don't know, the Maternity Consortium is part of the VCSE Health and Wellbeing Alliance, which is a partnership between the voluntary sector, the Department of Health and Social Care, NHS England and the UK Health Security Agency. And Tommy's and SANS co-lead the Maternity Consortium, which is made up of National Maternity Voices, the Pregnancy and Baby Charities Network, 5 Times More, the Muslim Women's Network and LGBT Mummies. And we work together with the Maternity Consortium members and with other Health and Wellbeing Alliance members to deliver a range of projects which focus on reducing health inequalities, facilitating partnership working between the voluntary and statutory sectors, and bringing service user voice to policy development and service delivery as well. So some of our projects that you might have heard of or you might not have heard of have been around understanding the barriers to accessing maternity care for those at risk of poorer outcomes. So for this project, we did a service user survey, focus groups and interviews with women and birthing people and their partners, and particularly focused on people who we might not normally hear from. And we developed some graphics showcasing service user voice about their experiences of maternity services and support, and some video case studies as well. So if anyone is interested in that, I'll be posting the links to the resources in the chat at some point when I stop sharing my screen, and we'll also send those round after the event. One of our other projects has been around sharing learning from the Starting Well Fund. So the other arm of the health and wellbeing funding from the Department of Health, NHS England and the UK Health Security Agency funds kind of programmes on the ground which focus on different priorities each year. So a few years ago there was a Starting Well priority focusing on preconception up to 2.5 years of a child's life. So we've been supporting the projects that were funded through that programme to share learning and amplify their impact. So we have been delivering webinars where they are kind of presenting on their work, some of the challenges they've overcome, their successes, and again kind of showcasing service user voice. So we had a great webinar on co-production. We had a webinar that was delivered in partnership with the Barnardo's Consortium, who are also part of the Health and Wellbeing Alliance. And we just had our final one as well. So I will send the links to all of those around as well if anyone is interested in that. And another project we have, which is being led by Maternity Consortium members Bliss, is around addressing inequity in neonatal care. So they have been working very hard engaging with families and healthcare professionals to understand what kind of parts of care within the neonatal unit might need a kind of focus around reducing inequity, and they have done lots of engagement work and a literature review, and they will be developing a kind of final resource and webinar for healthcare professionals focused on improving kind of communication skills and relationship building skills within the neonatal unit, as that came up as a key theme in their engagement work. So that's just a kind of flavour of some of the work we've been doing. If anyone is interested in finding out more, please do get in touch with me. We are just finishing up our year 2 projects, and we will be going into year 3 projects from April. So we will be sharing more about what those projects are with you all soon as well, if you want to get involved. So on to this event and this project. So this year we have been working on working with perinatal mental health services and maternal mental health services around ensuring equitable access to these services. There's thinking about inclusivity and accessibility, and this came from our barriers to accessing maternity care project, where mental health and wellbeing support was a key theme that women birthing people and their partners wanted more support with. So what we've been doing is kind of going out and meeting with services across the country to understand, you know, what work is already underway to reduce health inequalities, what the challenges are to delivering that work, how we as the Maternity Consortium might be able to support with this work as well. And we've been understanding kind of what good practice is already out there and trying to capture that, and then relaying that through a series of events, which this is part of. So for those of you who don't know, we did an event in October now on working in partnership with the voluntary sector and Maternity Voices partnerships to deliver more inclusive and accessible specialist mental health services. So we heard from the Hearts and Minds Partnership, Koala North West and Cheshire and Wirral Partnership NHS Foundation Trust, North Cumbria Maternity Voice Partnership and the MMHS in North East and North Cumbria, and NCT and Cheshire and Mersey Perinatal Service. So this was in response to services telling us they wanted to see examples of good practice of working in partnership with voluntary sector and Maternity Voices partnership. So again, for anyone who missed that, I can post the link in the chat and send it around afterwards as well. And then here we are for this event. Again, in kind of conversations with services, we were kind of told that there were specific communities that services were trying to reach and engage with the service, and they wanted to kind of hear from other services or other organisations who are working in that space to help them kind of understand how they should proceed. So we have developed 2 events. The first one is today, that's why it's called part 1. Today we've got 4 workshops that you chose from, and we've got, I think, 5 in the next event, all focused on different organisations who have done work in specific communities, who are sharing insights and sharing examples of good practice. And it's really just for anyone on this call who has an interest in the topics to just take what they need from it. So, you know, just learn from what's being shared, but, you know, we completely appreciate that not everything is going to work in every area in the exact same way. So take what you need from these workshops, make connections in them, ask questions, do all that good stuff. That's what these events are here for. But we're not suggesting that this is exactly how everything should be done across the country. So as I said, we'll have a brief introduction from NHS England now, and then we should automatically go into workshops that you all signed up for, but I anticipate there might be a bit of technical issues there, so we'll come back to that. We've got quite a lot of time to work with, so we should all get into our workshops fine, and then we'll just come back out of the workshops automatically again, briefly, just to talk about the next steps, get you signed up to the second event if you aren't already, and to ask you to fill out an evaluation form. So I will just stop sharing my screen for a moment and hand over to Lucy Ellis, Perinatal Mental Health Programme Lead at NHS England, for a short introduction.
Thanks, Celeste. Can you hear me okay?
Yes, we can hear you, thanks.
Great. So hi everyone, as Celeste said, I'm Lucy Ellis. I'm the Programme Lead for Perinatal Mental Health at NHS England, and I'm so excited about this morning's webinar. Thank you, Celeste, for all your work getting this set up, and for all the, particularly to all the organisations that are leading workshops today. So I sit in the mental health programme at NHS England, and given that we're running a bit short on time, if you're interested in the basics of our national programme, then we talked through it at the webinar that was in October. So Celeste, if you're going to post a link to that with a very brief intro at the beginning of that webinar. So we mainly think about the long-term plan ambitions for perinatal mental health. So thinking about the expansion of community perinatal mental health services and the establishment and development of MMHS, maternal mental health services, which are the new services, and they're smaller than perinatal teams and they're not yet everywhere. A joint focus between mental health and maternity, focused primarily on birth trauma, baby loss and tocophobia. So we also work really closely with the Maternity Transformation Programme, trying to address the challenges of working across services, which we all know can be difficult, but so important that we work in partnership across all our organisations. And with all the different kinds of expertise and experience that we bring, and that it's just awesome seeing people introducing themselves and seeing the range of people we've got here this morning. And in terms of this project, obviously, making our services inclusive and accessible to everyone is just so important. But we also know that the work to make that happen takes time and effort, and then takes time to reap rewards. And meanwhile, things are pretty challenging at the moment, aren't they? And just doing the basics is a lot. So, you know, but despite all of the challenges that we all know about, there's so much amazing and fabulous work that's going on right across the country. So I'm just really glad that we've all found time to come here this morning, and I hope that the workshop sessions give us all some new ideas and inspire and encourage us all to keep going. Let's see, I should probably plug some other webinars that are coming up, but for time, perhaps we'll post some links in the chat, and I'll post a link for NHS folk to the future collaboration platform, the health inequality space on that, that's also got a lot of resources that you may find